glasses, just treat them as glasses. There's nothing like a very complex thing in loops. Okay, simple as that. The only thing, as I discussed, if you want to touch your light, adjust anything like your glasses, just remove your glove, alcohol rub, do it again. Don't do it with your gloves. That's all you need to do. Another thing in loops is some people have a wire for their light. That wire cannot hang outside of your gown. If you're wearing that light, and this is again very important, it has to go inside your gown. And then take it out from the bottom of your gown and then put it in your pocket where your loop light is. So make sure your wire is inside the gown, not outside the gown. How do you manage dropping instrument material handpieces? Okay, this is a good one, which is again a common question for everyone. That's okay. If you drop an instrument, for example, let's see if I can move this a little bit. I cannot. Okay, if I drop something, okay, first thing you need to do is remove your gloves, alcohol rub, and then wear your gloves, pick them up, drop it in the area, in the sterilization area or disinfection area, and then again alcohol rub, wear new gloves, and do the procedure. Now when it comes to exam point of view, whenever you drop anything, or you do like drop a wedge, or you miss something that that you have done, you raise your hand and you have to call the examiner. The examiner will come and they'll ask you, okay, if this happens now, what you do in the clinic. So you just tell them, first thing I'll do is I'll remove my gloves, I'll alcohol rub, I'll wear new gloves, pick them up, I'll make sure that it's not a sharp thing. If it's, for example, if it's something like this, if it's an instrument, it's a mirror, no problem, you pick it up. If it's a sharp instrument, you can pick it up from tweezers and stuff like that as well. But you don't complicate, again, keep it simple, don't complicate yourself. Just make sure, remove your gloves, alcohol rub, I'll pick it up, and I will go and drop it in the dirty area in the sterilization room to get disinfected and later autoclaved. Either I'll go and drop it myself, or I'll ask my dental assistant to do it for me. This is exactly what I say. And then what I'll do is I'll come back, alcohol rub, wear new gloves, and I'll start the procedure. This is exactly a dropping instrument protocol is. Thanks a lot for Helenowski stating at least telling us from wearing the gown and steps to be followed. Can we steps so technical day? I think I've made it already. I've discussed that. If we use plastic cups, loop slide, leave them on all the time. Yes, you can leave the loop slide on all the time. You don't need to worry about it. As I said, consider them as normal glasses. They have a light on. The light can stay on the entire time. Just with composite, make sure, because the composite get cured, if you have a good loop light which has an orange thing to cover it, make sure you remove your gloves again, alcohol rub, cover them up, and then after you done with composite, then open that again. Otherwise, it's gonna set quickly. Keep the table tray. Okay, with infection control protocol, the burr thing, which is basically this, you cannot leave it open the entire time. So after picking up, for example, what burr you use, just keep it like this. It's important. Okay, this is important. Another thing is, once you have used something like wedges or any sharp instruments, put it inside your main trolley, not the trolley, or those containers, the steel containers, is make sure they're covered in there, not completely open. Otherwise, it's not a big violation, but best to do that. As soon as you do something, like as I explained last time, is that if you, especially when you use any sharp instrument like this, make sure just chuck it straight away in the sharps container. This is a disposable one, so the whole thing goes off. It's not like you have to remove anything. You don't have to do anything. Okay, wedges, soft flex discs, they all are considered sharps, so you have to put it in a sharps container. When we talk about amalgam, a lot of people have confusion that what to do with amalgam. Just make sure try to use a cotton if you can, and put all that waste. When you go to the exam, they'll exactly explain you what to do with amalgam. So in the orientation presentation, when they do, they'll already explain you everything, so you don't have to worry about that. Okay, they'll already explain you what to do. But for amalgam, you try to put everything as gather as much amalgam, the remnant material, as much as you can, and put it there, like after the cotton roll, chuck it in the amalgam containers they've given you. The other ones, you can always use the suction and just suction it up. So you don't have to worry about that. Do they provide scissors in the exam? I'm sorry, this is not a infection control questions. However, whatever is given, like scissors or wedges and stuff, it's already in the technical task. You already have everything in the trolley and the tray that I've provided you. If it's not there, ask the DA. If you're talking about skilled OSCEs, if there is anything on the clean area, that means there is. If there's not, there's nothing extra. Okay, so just have a look. Sometimes they change it, sometimes it's different, sometimes it's, it's very different. Infection control to skilled OSCE. CPR, you don't follow any PPE because a person is dying, right? You just follow the CPR straight away. My friends or all the people who have done CPR OSCEs, skilled OSCEs, I never got it. But yeah, you don't have to follow any PPE. Okay. Prescription glasses, again, I think I've discussed it twice now. Infection control while polishing temporary crown. So temporary crown, never do it in front of on top of your mannequin head or on top of your patient's mouth, basically. Okay, just do it on the tray, on top of your tray of your dental chair. Yes, always do it on top of that. And then another tip I can give you all is, whenever you finish your composite provisional crowns and stuff, always use water. If you don't use water, it's gonna cause some roughness on your provisional crowns, which a lot of people don't understand. How did it got there? Because you didn't use water. So always use water, and never do it on top of your mannequin head. Always do it on the side, on the tray, and then once you're done, bring it on once it's ready. Even if you see YouTube videos, you see Instagram videos, if you see any dentist in the clinic doing, they never do it on top of the patient, on top of the patient's mouth. They always do it on the side. Okay, hope that's clear. These are a lot of videos for following. I don't know why people do this, like following for part 1. Okay, I think these are all the comments here. Dropping instrument, putting on and off your PPE, I've done that. Prescription glasses and the basic infection control, I've done that. How do we adjust height before wearing PPE? Again, your chair is considered, you can't use your gloves for your chair. So if you want to adjust your chair for anything, remove your gloves, alcohol rub, adjust your chair, then wear your gloves again. Do not do it with your gloves on. Again, do not do it with the gloves on. How to keep our tray table, what goes where? That's according to everyone's different. There's no typical infection control protocol that your tray table should be on the right or your instrument wedges should be on the left. Doesn't matter. Just make sure any sharp things shouldn't left there. As soon as you use it, go chuck it. If there's any sharp wedges or fender wedges and stuff, put it inside your steel tray. Don't leave it open. Burrs, I've mentioned, don't leave it them like this. Always leave it here. For putties, a lot of people were asking me, should I leave the putty and go? Guys, again, just consider it as a natural scenario. If you're working on the patient and you have put 3 things on his patient's mouth, like a matrix band and something, and then you're going away to the toilet, it's a big violation for infection control. So you can do whatever you want to, but you should be at the station. For amalgam only, because you have already, they've asked you to amalgamator, you can use your gloves. That's completely okay, and you cannot remove the band and put the band again. So for that one, it's okay. But for putties and stuff, if you're leaving a station, don't leave your putty on the patient's mouth and then you keep walking outside. This is completely wrong. Would be great to know how to take care of prescription glasses. I have a question. How to manage dropping instruments. Okay, so dropping I've already discussed. So if you drop anything, I think it's the same thing. I think these are all the comments. Scissors important to hand washing and OSCE station, sanitize to find. If I skilled OSCEs, I've already discussed the skilled OSCEs. CPR, you don't need to do anything. So dropping instruments, let me tell you, dropping instruments, always you raise your hand. Tell the examiner that what I'll do is I will remove my gloves. I'll wear new gloves, pick up the instrument, go and drop it in the dirty area of the sterilization room to get it disinfected and later autoclaved. Disinfected first and later autoclaved. Either I'll do it myself or I'll ask my dental assistant to do it for me. Okay. What else? For example, let's talk about if you drop a wedge inside the patient's mouth. That's a tricky one. If you drop a wedge inside the patient's mouth, again, raise your hand. Tell the examiner that this has happened. Tell the examiner that, first of all, normally I use rubber dam for all my procedures. So in the normal scenario in the clinic, this won't happen. However, it's a complication and it can happen. So what I'll do in such cases, first of all, I'll stop the procedure and explain to the patient what has happened. I will see if it's somewhere inside the mouth and still not completely, the patient hasn't completely swallowed it. I'll try to take my high-speed suction, high-volume excavator and try to suck it out. If I cannot, what I'll do is I'll inform the patient what has happened. And in the first 24 hours, I will get a chest x-ray done because to see where it is. And if you can't, then there's a protocol that you read therapeutic guidelines and follow that. But again, you have to explain to the patient very well and confidently, because that's they want to see if something happens, because complications are part of dentistry. Okay, you cannot say that this will not happen. This can happen. You can have dropped instruments. Another thing is, so you do the chest x-ray, and then if it's a sharp one, you can always refer to the GP as well and explain to the patient this has happened. And after the first tell them first hour is very crucial, otherwise it can go into the airway passage or can go even the lower passage as well. And then you may order abdominal x-ray in the first week after 7 days, just to confirm it's inside or it may have excreted out from the normal system. So there are a couple of things. It's very clearly mentioned in therapeutic guidelines, the protocols. Read them, and when the patient asks you, very confidently, relaxedly, just explain to them. If you drop something which is like in hands, just tell them, because this cannot be disinfected, I will just again remove my gloves, pick it up, drop it in the sharps. And in hands is also considered sharps. Anything polishing, they're all sharps. I'll chuck it in the sharps, and then I'll just get a new one, because they cannot be autoclaved. Okay, if they're talking about soft leg discs, if you drop it, just tell them I'll chuck that one. But if they want to know about the mandrel, just tell them that the mandrel, we will again put it in the dirty area to disinfect and autoclave later, but the soft leg disc itself is just of one use, so we'll just put it in the shops. How about if you drop a handpiece, and if the examiner says, okay, this is the only handpiece you have, now what will you do? So just tell them that normally we definitely would have more handpieces in our clinic. However, if this is the only instrument and I really want to use it, I can inform the patient that this has happened, and if it's all right to continue the procedure again tomorrow. But this is again not a very good answer to say. So just tell them that in the latest autoclave we have in the clinic, there's something called as a wash cycle. It only takes 5 minutes. And because I cannot use the instrument or anything that goes inside the patient's mouth just by disinfecting it, so we'll have to get it autoclaved. So there's a wash cycle. It only takes 5 minutes, and I can use that. If you really want to know the measurements about wash cycle, just go and Google it, and you'll find them out. Okay, but at least you should know. So anything that can be autoclaved and like simple instruments, you definitely have more, so you don't have to worry about them. Okay. If there's something that really needs to be autoclaved and you really need to use on the patient, just tell them there's a wash cycle. It only takes 5 minutes. It's a quick cycle, and we can get that. The only problem with wash cycle, it's very porous for the instruments. They don't like to use it, but you can still use it for emergency cases. Let's talk about this question, which is very interesting. This is what you get, and this is your transfer tweezer. So if you want to get anything, you pick it up, pick the instrument up. So this is considered clean and dirty. So this is a transfer tweezer. So you can go inside the dirty trolley and pick instruments up, or if you go inside the clean. So basically this one, my apologies, this one is considered clean, just not a dirty one. You cannot go inside the in the dirty area with this. You can only go in the clean area with this. So you pick it up, go to the clean area, you pick whatever you want to. This is the case if you don't want to remove your gloves. So for example, there's something in the trolley and there's something in the drawer which you want to pick it up and you don't want to remove your gloves. Either you remove your gloves, alcohol rub, and then go there and pick it up. Either you pick this up and then go and open this up with the trolley, pick whatever you want to do, or open the tray, and then in the clean area, pick things up and drop it, and then put it back in. Just in case, what some people do is they accidentally put it in the dirty area. Now it got mixed up. Why this came in? Let's go back. Yeah. For example, if you drop it in the dirty area, okay, and now the problem is that you mixed it with dirty area. Now what will you do? So you raise your hand again, call the examiner, and they'd say, what will you do now? Just tell them that because we have heaps of tweezers in the clinics, right? So just tell them that, sir, like, you know, what I'll do is I'll ask my nurse to give me a new tweezer, and I'll use the new tweezer like with the normal thing I was using, and I will consider this dirty, and we'll just autoclave it later once we finish the patient. Okay, so just tell them I'll consider this dirty, and then I will just use it with the dirty instruments. I won't mix it up here, and I'll just get my nurse to give me a new one. This is simple as that. You don't need to complicate to autoclave this one because we have heaps of tweezers, right? Tell them that, you know, in the normal scenario, I'll do this. However, they will tell you that, you know, just use it for now. They just want to check what you want to do. They just want to check your mindset. Another thing is temporary crown. If you drop your temporary crown on the floor, what will you do? You will do is that you pick your again, you raise your hand. The examiner is going to walk in. Just tell them I'll remove my gloves. I'll pick up the temporary crown, and then the only problem with temporary crown is that you know, it cannot be autoclaved, because sometimes with the temporary material you put it in the autoclave, it's going to shrink all that. So just tell them it cannot be autoclaved. So and with disinfection, it's not a good way because it won't kill the spores. So we need to have it autoclaved before using it inside the patient's mouth. So what I will do is I will have to make a new one in the normal scenario. However, because it's in the exam scenario, I will just consider that it was never dropped. So if you're okay, I can use this now, and they will be more than happy to allow you to use it. So for things like crowns and stuff, definitely they cannot be autoclaved. Okay. For things like this, just tell them that, you know, I'll ask my, for example, if you drop a mouth mirror, just tell them that, you know, I'll ask my nurse to give me a new one. And we'll put this in the sterilization area. If they tell you that, you know, this thing has to be done, if there was a screw or something which was really important, or there's a high speed that you only have one that you use for implant case, so you tell them that if I really need to use it, then I can just go do a wash cycle. However, yeah, so you can check the readings of the wash cycle as well if you want to. But yeah, I think it's pretty much it. I'm not sure if I missed anything. So technical day, again, it would be, you know, just follow these protocols. It would be, everything will be discussed in the orientation presentation. They will explain you everything in detail. So you don't have to stress. If you have any questions, please ask them at that time. If you ask them at that time, they're more than happy. They're very, you know, cooperative. They will definitely help you with that. Okay, so I think I don't see any other questions here. Most of them are following. There were some questions I've already ordered. So yeah, just to have a quick recap, make sure when you're doing washing hands, you must be doing the 5 movements of WHO. You be washing till here. Don't wear any bands or watches or rings, or make sure your nails are really sharp and clean and small, not long nails. Again, whenever you remove your gloves, alcohol rub. Whenever you leave the room or enter the room, you always wash your hands. Make sure spend a good 40 seconds. Follow the 5 WHO movements. When you go to the skill DOS keys, make sure that, you know, enter the room 3 minutes, read it, have a look around. As soon as the bell rings, you wash your hands, go to the clean area, pick whatever you want to do, pick and drop them either in a tray or by your hands in the trolley or the tray in the dental chair that we'll be using on the patient. Whatever instruments you want to use them, drop them there. Then you go and then, alcohol rub, wear a mask, wear your glasses, and then wear your gloves, and then start doing what you're doing. When you remove them, remove your glasses, remove your gloves, remove your glasses, wipe them, put it in a trolley in a clean area, go wash your hands, remove your mask, go wash your hands, then before leaving, pick up your glasses and then leave. Okay, so it's very simple as that. Infection control is not very very tricky thing. But if you drop something and don't tell the patient, or if you don't touch your glasses again and again, a lot of time what we do is we panic and we make a mistake. So my recommendation and my suggestion, like a friendly suggestion to all of you, practice infection control daily. Because if you don't practice infection control daily, you will end up doing a mistake, and you won't even realize. When it's a stressful situation, you're gonna panic and you'll do something, and you will say, I didn't never did something, but maybe you did and you didn't realize you did something. Yeah. So make sure, follow it every day. Follow it every day. At your home, at your workplace, if you work, if in-house, if you're working, never work without your gloves and masks. Never work without loops. Always follow the protocol, because if you do it on a regular basis, if you do every day, it would be easier for you to follow. Because even when you panic in the exam, your natural instinct, they start working. So whatever you've done on a regular basis, on an everyday basis, it's going to come out. So make sure, do it on an everyday basis. Otherwise, you're going to panic and you're going to do a mistake, and then you won't even realize what you've been done. Okay, so washing hands and then following the PPE protocol. For your exam, you just need to worry about 3 things, as I said: mask, gloves, and glasses. Another thing, side shields, I've already explained, they're part of your armamentarium. Dropping instruments very easily. And then, dropping inside the patient's mouth and stuff, you can always read, that's clearly mentioned in therapeutic guidelines. So, you stop everything first, explain to the patient what has happened, and then, try to see if it's somewhere inside the mouth, or sometimes it's dropped inside the clothes and stuff. See if you can find it. If you cannot, and if you can see somewhere, take it out from your high volume excavator, high suction. And then, if not, first 24 hour, first hour, it's very important to get a chest X-ray done. Otherwise, we'll go in the inner passage, and then, you may not be able to see it. If it's a sharp instrument, for example, a file or a very fender wedge, then, if it's a sharp one, it may become a complicated, and then you may have to refer to the GP or a specialist straight away. Okay, so there are a lot of things you need to work on, but infection control is very basic. You just need to follow these things. And if you have any questions when you explain the examiner will explain you on the first day. They'll give you a presentation, what to follow, what not to follow. Please ask them questions. Please ask them that, can I do this? Can I not do this? Okay, so communication is done. Skill doskies, I think I've explained. Technical is good. Dropping instruments is good. I don't think it's anything remaining to, as I said, if you want to touch the patient mannequin to tilt, you can always tilt 45 to 45. 45 to 45, you can tilt right to left. It's completely allowed. Do not touch your loops with gloves. You can touch the dental chair light. You can touch the mannequin head. It's completely okay. There's no problem in that. If you want to adjust your dental chair, not the dental chair, your dentist chair, if you want to move it up and down, don't do it with gloves. Remove your gloves, alcohol rub, go up and down wherever you're comfortable. Again, alcohol rub, wear new gloves, and then continue what you're doing. Any problems, you drop something, or if you mix the tweezer with something, make sure, raise your hand, explain to the examiner. There's a reason they have cameras these days. If you try to cheat them and they find out, you may lose your whole exam. You may not even get another attempt. I know candidates who have done something and they just, first they disqualified them and later they never even got an attempt. There's a reason they have cameras. A lot of people have tried to cheat the system, but don't do that. If you really love this process and if you really want to pass and if you really are, passionate about this, you may lose your whole thing and you may never get a chance again. So please do not try to cheat them. If you have done something wrong, just raise your hand, explain to them that this has happened and just think like a dentist. Think like a dentist. Just imagine you're in a clinic, you're doing a patient, this happened, how will you manage? Just exactly talk like that. Just stay, relax, stay confident, try to control your nerves and just answer them that, this is my patient, I dropped an instrument and this is how I'm gonna deal with it. And trust me guys, if you follow all the protocol and explain to them properly, no one will fail you. They're not sitting there to fail you. They won't. I did 11 infection. I did 7 thing. I dropped an instrument twice, actually 3 times. I dropped a wedge inside the patient's mouth. I mixed my tweezer. I did 7 things. I raised my hand and explained to them properly. If someone would have failed infection control, that would be me. But the way I explained to them, I think they were quite comfortable. And as I said, it's part of the complication, are part of dentistry. There's no dentist or anyone who can say that, I'm 100% safe. No, nobody's 100% safe. These things can happen. These things can happen and will happen in the future as well. You just should know the protocol. That's all you need to do. So something happens, just raise your hand, tell them that this has happened, and I would follow it this way. This is all you need to do. Okay, so I think I've covered everything in detail as much as I can. If I've missed anything, my apologies. And again, if you like the video, please share it with your friends. The main aim of this group is to help maximum people out. Okay, if someone can take advantage of it, like I really I was feeling glad that so many people messaged me that they actually didn't know how to make a putty, and they were like thanking me and stuff. So there's no problem, I'm more than happy to return the favor as much as I can. But yeah, just share it with your friends if you find it useful. And again, just give me some feedback. Let me know how did you find this video. And it's still, if I've missed something, I will try to do maybe another video to mix that up. But I think this is a basic infection control protocol. Just follow that, keep it simple, and you shouldn't face any more problems. So that is me signing off again, and I'll see you all next time with another video. I possibly might do an assessment video on 2-3 different tasks and explain you a little bit the criteria, how do we assess the tasks. And after that, I may do one on communication, because I feel communication is my strongest points, and I'm quite comfortable with teaching and talking about it. So I'll talk about that. And I'm also planning to do maybe once every fortnight a session on Zoom for as many people want to join, just that I will become like the examiner, and we'll do like a live scenario, OSCE scenario, and I'll tell you once you have done that practice with me that what mistakes you're making. So I'll try to do that once every fortnight, which I'm planning to start very soon on a Zoom session, so maximum people can join. The only thing I prefer this video over the Zoom session is because once it's ready, everybody can take advantage of it. Even if someone missed it, they can see it later. But with Zoom session, if someone misses it, they can't see it later. But we'll plan something, and then I'll see you next time with another video. If you like it, share with your friends, and I'll appreciate some feedback. God bless you, everyone. Bye bye.